Is every patient that you see different? Well, I know what you're thinking. Of course they're different. Everybody's different. That's why we have to have different ways to evaluate different people. So we should be evaluating athletes differently than we evaluate sedentary Medicare patients. And that's why we have different treatment techniques. So some people need cupping and some people need needling and some people need stretching, but some people need strengthening, but other people need more mobility, so we should be foam rolling them, but then other people just need pain control, so we should be doing E-stim with them. So this is the clinical medical model that you've been taught and sold, which fails. So what I'd like to tell you is that all of your patients are the same. So every patient that you see on the wall behind me, this wall goes all the way down there and it goes all the way over there. Every single patient that's on the wall, I treated with the same thought process. I treated with the same treatment strategy. I got the same phenomenal results, and I gave them the same patient education. Now, is every one of these patients unique? Was each one of their presentations unique? Yes. But when we dial down and see what we are going to treat and understand how to evaluate them in order to get to that treatment, and then understand how we need to educate them as to what we did and what they need to do going forward to keep making progress, and then eventually get to the point where they don't need to see us anymore, but they understand what they should and shouldn't be doing moving forward. That's all the same. So every single patient, unless you are watching this and you're a veterinarian, every single patient that you see is going to be a human being. And even if you are a veterinarian, the animal physiology that you're going to see, neuromuscular physiology, is basically the same as human neuromuscular physiology. So even though this guy is I think 8 or 9 time CrossFit Games champion now, his physiology is the same as this guy's physiology, who was a high school football player, who had the same physiology as this person here, who is an extremely successful competitive dancer, who has the same physiology as all of my Medicare patients and all of my car accident patients and all of my work comp patients. So I don't have to change my thinking when I evaluate and treat them, and neither should you. So the take-home message here is that, yes, every one of your patients is a unique individual with unique presentations, but if you start with the understanding that they are coming to see you because you are a medical expert who should be able to dial down to their root cause of their pain and their injury, or if they're coming to see you, maybe you're a personal trainer or a strength coach, they're coming to see you for athletic performance enhancement or injury reduction, you're still dealing with human physiology. And if you understand human physiology and understand how to apply that to your evaluation, your treatment, your patient education, and your exercise prescription and progression, you don't need to change gears no matter who walks in your clinic. And every single patient that walks in your clinic walks out of your clinic because you understand how to get to the root cause. You understand how to reverse the issues at a neuromuscular level that they are having, which increases their range of motion, increases their stability, decreases their complaint of pain, decreases their swelling, because you maximized neuromuscular function. That's all you did. So you don't need to go through the gamut of, should I stretch them or should I strengthen them? Should I cup them or should I needle them? Should I K-tape them or should I E-stim them? What you should be doing is a very specific evaluation that gets you to the root cause, reversing the root cause. Then this is where it gets to the patient being unique. Then what you prescribe to them as their home exercise program is going to be unique to what you found their limitations were, which are going to be unique across the board. So this swimmer had different issues than this football player had, and these track athletes had different issues than this soccer player had. So each one of their individual treatment sessions was unique. Their patient education was unique to them, but the underlying message was, here's what we did. got to the root cause, reversed the root cause, and then their exercise programming is going to be unique to their situation, their activities, and how well they are progressing. So if you take a step back when you go into the clinic or you go into your gym or your training facility, and you think about what the root cause is and how neuromuscular physiology works and how you need to be the expert that understands how to bias those things. So you're focusing on why they came to you. They might think they came to you because of pain and swelling and lack of range of motion and muscle spasm and tightness and all that stuff. But you're going to break all that down and say, we're not going to worry about treating those things, because when we do worry about treating those things, that's where we fall into the symptom modification or the symptom gimmick thought process, which takes us way far away from root cause. So when you're ready to understand that every single one of your patients can be evaluated the exact same, can be treated with the exact same thought process and treatment strategies, be given the same patient education, because with every single one of those patients, you got to the root cause, you understand neuromuscular physiology, and that's how you educated them as to why they're going to be doing the exercises that they're going to be doing, and why you're taking away the things that were actually making them worse, which is unfortunately a lot of the things that conventional physical therapists, chiropractors, massage therapists, athletic trainers, personal trainers give to their patients because they forgot about human physiology. They forgot that forcing range of motion may get more range of motion, but it does that by sacrificing strength and stability. They forgot that covering up symptoms doesn't get to the root cause, it just prolongs the recovery process. They forgot that doing a lot of the things that physical therapists do actually increases the risk of injury and decreases performance. When you're ready to learn how to do that, let me know. Get in the shift. I'll change your career in 4 months by showing you how easy and streamlined it is when you understand that every single patient that walks into your clinic is a neuro patient. Yes, your ankle sprains, your ACL tears, your headaches, your plantar fasciitis patients are neuro patients, not orthopedic patients. And once you understand that and understand that every single patient should be treated the same, your career will take off, your patients will get results, and you will be satisfied with what you are doing every single day.